by way of legislation, can you be more specific? You're talking about helping the poor.
Yeah.
Iba yung trabaho ng volunteer doctor sa senator. Ano yung specific legislation?
Ang target ko naman yung Committee on Health lang eh. O, sa Committee on Health, like sa cheaper medicines bill, di ba? It's been there for a long time, but still medicines are expensive. 5 times more expensive than other countries, yung mga chemo. Yung cheaper medicines kasi natin, nag-focus only on the mga simpler medicines like for high blood, diabetes. But the specialty medicines are still very expensive. Chemotherapy, rejection, medicines for the brain, bipolar, depression, those are very expensive na life-saving. So we can focus on that, at least to lower it a bit.
Why, sir? Why?
Price, how do you remedy that? By legislation or by regulating the manufacturing side? Or ano yun? Sa pricing ba yun? Or importation cost? Anong
Maraming strategy. Pwedeng importation, merong way to regulate, like what they did before. They lowered the price of medicines before, like for amlodipine, di ba? So, and also there are free medicines being given out by the Department of Health, which is worth, I think, 500 million. So that's only maybe 0.1% of the need. So we can expand that
What
also.
is the limitations, from what you've seen, the limitations on the impact and potentials of the Generics Act?
Generics Act.
I mean, did that have an impact on prices? And what are the limitations?
Malaking impact ng generic medicines. But it's only for those simple medicines for high blood pressure and diabetes, maybe for antibiotics, doon lang. But yung mga ibang needs, ang dami nating needs. Like for dialysis patient, they have this special medicine, phosphate binder. They have to spend 300 a day. Yung mga heart patients, there are around 5,000 mga heart cases. Meron silang special medicine na kailangan din. So, alam ko yung what they need, ano yung nagpapabankrupt sa kanila eh. Because the salaries of the workers, even the pensions, are placed in medicines. So, actually, I'm surprised with the survey saying that the most important needs of the Filipinos are jobs, health, yung mga corruption. When you go to the barangays, ang number one hihingi nila, gamot.
Sir, by way of tangible targets, by how many percent or by how many times do you think we can bring down, for example, medicines of certain kinds of illnesses? I don't know, for chemotherapy, I suppose, or so on down the line. If you look at regulating these other loopholes, for example, yung marketing costs, target-wise, by how much do you think we would want to bring down the prices of medicines?
As much as I can, diba, to help the people. But I'm not anti-pharma, anti-business.
Keeping in mind,
we want them to earn by bulk, by volume.
Within reason, syempre.
Within reason. Maybe 10 to 20%, happy na ako. Because even 10 to 20%, you lower the cost, you're helping everyone. Diba? We're helping the whole country.
Yes, but in general, how much more expensive is medicine in the Philippines compared to the region lang, compared to our neighbors? Let's say
For
Thailand.
chemotherapy, may mga 5 times more expensive. May iba 3 times more expensive.
Within the region?
Yes, within the region. So that's a big issue.
Okay, sir.
It's a can of worms and I'll try my best to do that. Kaya nga pag-campaign ko, sabi ko, I will not ask for donations from anyone, from businessmen. I'll just rely on social media and free guesting sa mainstream media. And it's okay if I lose, at least I won't be beholden to any company. Kasi may following naman ako eh. Parang, I wanna try it cleanly.
I remember the late 80s, during the push for the Generics Act, there was quite a bit of resistance to generics. In fact, there were a lot of stories coming out about, supposedly generic medicines being, supposedly inferior
yes.
or in some cases counterfeit. But on the other hand, if you do comparatives of the prices, ang laki ng kaibahan ng presyo natin sa presyo sa ibang bansa.
Correct.
Are you meeting any resistance? So what kind of resistance do you expect from this? And if you look at the past 30 years, kamusta ang generics? Kamusta yung efficacy ng generic medicine compared to the branded ones?
The problem with our FDA, it has kulang ang funding ng FDA to check our medicines. So I read some studies before. for a few generic medicines that some are maybe 10% less effective than the branded one. Some of them. But compared to the price, if the price of a branded medicine is 20 pesos, the generics are only 2 pesos, I think the patients will get well if they take the 2 pesos and take it every day instead of taking the 20 pesos and take it for one day.
10% lang yung
Ang reduction.
At the most.
At most, doon sa isang study.
So mga wanted of a day lang yung delay mo sa paggaling.
Pwede na.
Madidelay ka lang mga 2 oras.
At 2 pesos
Pwede damihan mo na lang konti. Oo. So it's only... Ang problem kasi, if you just say the generics are poor quality, then you have to buy the expensive one. And if we do not reduce the price of medicines, how can we fund universal healthcare?
Yeah.
Diba? If we're gonna use taxpayers' money, we should not pay so much. I think I'm the one talking about cheaper medicines. I'm not sure if there are other advocates for cheaper medicines because you know how strong the pharma lobby is. But I'm not anti-pharma. Many of them are my friends with my following. I tell all my patients, you continue your medicines for high blood pressure, for diabetes. Just moderate the greed a bit. Because sometimes the prices are 4-10 times the cost.